We have two countries who have well-established DHIS2 implementations ranging last 10 years, Laos and Bangladesh, who have strong HISP network support from HISP Vietnam and HISP Bangladesh respectively. So they will present the challenges of the evolution and the scale that they saw in their countries. Then we have the first country in the North African region, Libya, who started their DHIS2 implementation in 2017. So Libya presents a unique story of building information systems in challenging situations and scenarios. So we'll have a very interesting story for Libya. Then we have two countries from Central Asia, which is a new emerging region for DHIS2 needs and information system needs, Uzbekistan and Kyrgyzstan, where we'll see that there are different challenges for language barriers and capacity building, etc., and the digital literacy as well. So today we have a mixed set of countries who bring their own unique challenges, and we'll see how the Ministries of Health and the HIS groups who have been supporting these countries have tried their best to raise their DHIS implementations in country. So to begin the session, just some guidelines. So the presenters will have 12 minutes to present their presentation, and we'll dedicate 3 minutes for the question and answer from the audience. So you'll have the timer on the left-hand side. So kind request to please keep a review of the timer when you're presenting so that we don't overshoot the question and answer round. So let's start with the presentations. I'll request the representative from Ministry of Laos to please join us on the stage and present the Laos story of DHIS2 implementation. Thank you.
Good afternoon. On behalf of the Lao team, I would like to present experience of the Lao DHIS2 implementation in Laos. So actually, I can talk about the how DHIS2 has been implemented in Laos, what achievement and what lesson learned, and what in the future we are going to do. So really briefly, that we are based on the health sector reform that we have. One pillar talking about health information. So this is the story that we have been implement. We start from the 2013 by introducing the DHIS2 in Laos. First, we just use aggregate maternal and child, and then step by step we are moving integrated different vertical program into the system. And now we already have many systems integrated into DHIS2. So I just skip it. This is also the same story with different countries that we start apply DHIS2 as a national health information system platform to collect, to report, to analyze, and to disseminate health information in Laos. So until now, we already integrated into system many program. As I said, that we start by the first program, we integrate maternal and child, and then we step by step integrated vertical program like a global fund program like malaria, TB, HIV/AIDS, and then we also integrate disease surveillance. I like to mention that before DHIS2, the vertical program, they also have their own platform to collect information. But when we start DHIS2, and then we try to convince them, we try to show them that DHIS2 platform can be a solution for them. So they join the platform since 2017, 18, and 19 until now. So this is the landscape of the health information system in Laos. So you can see that there are many programs integrated into the system, including MCS, recently the COVID-19, and also TB, malaria surveillance system, and recently we also included the here. You can see different color here because as yesterday presented by Oslo people that they have aggregate, we have event capture, and we have a tracker. So we include, so some program they have event capture, some program have tracker, some program they have all three tracker, event capture, and aggregate together, depend on the needs of the. But aside from that, you can see that there are systems that are not integrated into the DHIS2 yet. For example, the health financing, the human resource, the hospital information still silo that we need in the future. We are going to integrate it, even though we already start and we already integrate the electronic medical record hospital information system into the DHIS2 in some hospital already. So this is the main information system in Laos. So what achievement we have? We also have developed a lot of guidelines we translate into local language so that people can, the health staff can use easily. We also develop some of the electronic guideline and also YouTube so that people can just use it. So this is an example of the training we have conducted in the country and outside the country. Some of dashboard that we have regularly used for monitoring key indicator. Actually, the government have 11 indicators that health sector need to report to Parliament. So we use DHIS2 to report, to capture information and report to the Parliament every quarter in each level, provincial, district, and central level. So what experience we have learned throughout this one? So meaning that first of all, we need to have a very clear, realistic, and achievable strategy. We have to have a strategy, so that strategy is not difficult to implement. We have to develop that strategy can be implementable, and now we only moving to the digital health strategy. I will talk later on. Secondly, I think we need to work with the partner in the country, because different partner they might approach the different Ministry of Health, introduce different platform, but we need to convince partner that we have this in the system. It can be done. It can be provide information to all the program. So we convince them, because the different partner they have provide different resources to implement the DHIS2 in Laos. We also need to have a strong core team in each level. Like yesterday and already presented, we have to have the steering committee. We should have the operational management. We should have the technical team. So at all the three levels that discussed yesterday, I think very important that we need to set up. Before that, we also have. Now we are moving to the digital strategy. We need to set up another organization that to support the implementation of DHIS2. Yes. So what we are going to do? So as I said that before that, we have DHIS2 since many years, nearly 10 years. We're happy about it. However, we think that it's not enough. So because aside from that, we have running different programs like hospital information, lab information, human resource, health financing. All these need to be integrated into the system. So we need to have a bigger strategy. So we now, the government have strategy on digital transformation to all sectors, so including health sector. Now we also, Ministry of Health under our department, we have developed, we already complete development of the digital health strategy from 2023 to 2027, and we already implement since beginning of 2023. Now already 11 months we already implement the strategy. We got a little bit moving on this. So as I said that when we develop the the national digital health strategy, we identified that the weakness, the lowest score of the majority of digital in the system is the workforce. That's why we need to, first of all, we need to build the capacity of the staff of the Ministry of Health to know the to know what's the digital, and also we need to increase data use of the system, use of the system, use of data for planning, for decision making. So we have conduct several training for the high level, for the head of the department or head of the center to know what is in the system have. So we also need to change management. We need to organize. We need to set up a technical committee. Actually, technical committee for this already exists, but we need to update it. And also, we need to set up the we call it digital strategy coordination office, and also because this office will coordinate, and we need to also disseminate the new digital strategy to all partners so that they can have a look and what support they can provide it. The strategy is very simple, that really lay out all the there are 5 components. There are 5 strategic objectives. There are 16 strategic objectives and 37 projects and 132 activity, all already costed. You just the partner just have a look and what area they can support. And also in the digital strategy, they also mentioned that we need also integrate with different program like EMR, climate, and other things. So we need to working with also different ministry to implement that strategy. So I think the next speaker, I need to invite the partner, Sophie can present to continue my presentation on how the partner working to convince that we have only one platform, DHIS2 in the country. Please go ahead.
Good morning. My name is Sopawan. You can also call me Sophie. I work with the World Bank in Laos. And I've been working with Dr. Chansali and Ministry of Health in the DHIS2 platform for more than 10 years. As you can see that we have 10 years experience, and the World Bank actually introduced DHIS2 to the country in 2012 through our active project with the government. And as you can see, the DHIS2 in Laos is 10 years, and we have a very strong collaborative with other development partners. More than 10 development partners now join us to support the Ministry of Health to improve the health information system and also apply the DHIS2 in the country. And within the World Bank, we have like about 9 projects, active projects that support digitalizations and applied information system in project implementations. And many projects have health data. So we are trying to coordinate within the organization to share the information and improve the implementation. And actually, 10 years, if you implement a health information system, you would see there's many problems as well. So there are issues that MOH identify, and we, the World Bank, mainly focused on 4 areas. There's like data collection through different platforms, and there are data inconsistencies, there are gaps in data collections, problem with definition and standardizations. And also there are many databases that is not linked to each other. So we focus on these 4 areas and provide technical support through our active project and implement by the Ministry of Health, and also our technical support from the World Bank team to help to collect the data and make it more accurate. So I think right now the issue is still like the accuracy and the quality of the data is still an issue, and we are trying to continue and improve the situation. And we are preparing a new phase of the project, and we propose the government to continue strengthen the system and improve the capacity of the ICT support in the country. Right now, we have HISP Vietnam and team to support us, but within the Ministry of Health, we don't have the ICT person who actually can maintain the DHIS2 system. So the capacity building is something that the country need now. Second is the use of the data, as Dr. Chansali mentioned already. We have a lot of data in the system. We have aggregated, disaggregated, but the capacity to analyze the data and use the data for planning, budgeting, and also make the service deliveries available in remote area is not yet there. So we are trying to encourage the government to use the data to help health system to be more efficient and cover people who are in need of healthcare service, especially in remote area. And another area that we are trying to do, and we believe we can do it, but we also need help, is the interoperations. Okay. So this one, we're gonna learn from this conference, and we're gonna go back and we're gonna call for help as well for the interoperations. And we're also gonna support the digitalization and the digital health strategy in the ministry. This is the plan for the next 5 years that we are supporting. Thank you.
Thank you. Thank you.
Thank
So
you.
if you have any questions, you can ask. Thank you. Bye.
So yeah, I think thank you for the excellent presentation, sir. So we see that Laos is one of the good examples of a scaled implementation where they did vertical and horizontal scaling over the last 10 years. And now they've identified their 4 main pillars of building interventions further, making them as their foundation guidelines for enhancing their HIS. So before we go to the next presentation, we just have time for one question. So if someone has a question for Dr. Chansley, then please can ask now, or he'll be around during the conference days as well, so we could have a discussion again. Any questions? Okay, so I think we can proceed. So next we have a unique implementation story from Libya, where they started their DHIS2 journey 6 years ago. And Libya has some unique circumstances of being having unstable political environment, but despite the challenges, the country has been able to scale up their system at the national level and build a very strong core team by participating in the DHIS2 Academy program. So I'd like to invite the representative from the Ministry of Health Libya to please take us through the Libya implementation story.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Good morning for everybody. I am Muhammad Ibrahim, the Director of Health Information Center at the Ministry of Health in Libya. It is really my pleasure to have the opportunity to participate in this very important conference. First, I would like to thank very much the organizers of this conference for giving me this opportunity and for facilitating my presence here today. Especially Mr. Surab and Dr. Bamud, who actually were our partners and friends through all the journey of DHIS2 in Libya. Actually, to stick to the time, I have to go directly to the presentation. Outlines of my presentation will be just introduction, then DHIS2 in Libya, the story, and then design and domain of DHIS2 in Libya, current situation and the use of DHIS2, main achievements and main challenges, and then recommendations and area of interest. Libya, as you know, is a wide area. It's 1,600,000 and 65,000 square kilometer. It's actually 6 African countries around Libya. It is in north of Africa, and you can see Tunisia, Algeria, Niger, Chad, and Sudan and Egypt are surrounding Libya. And of course, Libya has 1,900 kilometer coastal area in the Mediterranean. Population of Libya is around 8,415,000. And Libya and male and female are nearly the same. It is just, I think, next census will be the same number. Administratively, Libya is actually divided into more than 100 municipalities. Recently, they have divided it into 6 regions, as you can see, and some statistics are done accordingly. The journey of Libya and DHIS2 started with actually health information strategy in 2018. When we were discussing the gap of health information system in Libya, and we discovered that the routine data of health facilities are not available. So, and this is why we decided in that time to include DHIS2 in our strategy, and since then we started to work on it. As you can see, Libya is, I don't want to tell you where it is the head of the map of DHIS2 users in the world now, because it's the north of Africa. Unfortunately, the 2 countries beside are not using DHIS2 nowadays. So Libya was the pioneer actually in North Africa for the use of DHIS2. The first activities were actually it was in beginning of 2018, where Engineer Sorab came there, and we started the customization of Libyan health information system to be adapted to DHIS2. Later on in the same year, there was the core team training in Tripoli. Also, you can see that Sorab was there, and I'm really very grateful for him, because it is worth mentioning that the security situation was very difficult at that time, and the 2 people were involved in this matter was Dr. Bamod from Sri Lanka, who first visited on behalf of HISP India and HISP Sri Lanka. And then later on, Sorab with the other group, they came there, and the security was very, really difficult for them at that time, because at the first time, even they were not allowed from their countries to come there because of the security matter. Then, at the same time, they have trained TOT, 2 courses, one in Tripoli and one in Benghazi. In the same time, it was in August 2018. The SOP was actually prepared for the core team, and one prepared by the core team for the end users there. And you can see it's in the screen. To make the long story short, this is the journey of Libyan DHIS2. 2018, from the beginning, in January was the customization, and then training 2018 in July and August. 2019, we started rolling out. 2023, it is the rollout completed for all health Libyan facilities. It's the system on and available. The link of this system is here, and also it's linked to our website. It's called saha.ly, where you can be linked to Libyan DHIS2 system. The domain of Libyan system actually, as all you know, that it's aggregate data, tracker, and event capture. And also we have used it successfully for health surveys. Aggregate data collection, I'll show you the forms used in Libya. The tracker, only we have trained for TB centers, and we're expecting them to start in 2024. For event capture, really it's used for different purposes, but the main thing that they have designed is for capturing data of health facilities in the health survey. It is written in yellow that private sector is not included in our DHIS2. And as my experience as a health information director, it is very difficult to include private health sector in such matter. These are the forms we are using. We are using for primary health care around 17, as you can see, including vaccinations. Actually, three main parts of the information: resources in the health facility, and services provided by the health facility, and some health status like the death, cause of death, and something like this, especially in hospitals. So this form is for primary health care. These forms are for hospitals, and you can see also using ICD for collecting data of cause of death and morbidity. Current situation and use of DHIS2. DHIS2 in Libya is used very much nowadays. You can see here that we have municipalities. It's in Arabic, of course. Hospitals, branches of National Health Center for Disease Control. We have the list of isolation centers during COVID, was very much useful, and the data is used. And we have also the centers for dialysis. You can see here, red, their map of all hospitals in Libya, and here all health facilities in Libya are available through this DHIS2 system and use it. Of course, you can see the map how the arrow is going up. The users now are 2017 person, and when we started in 2018, it was only 186. Also, the amount of data available now is growing up, especially after 2022, because the Ministry of Health, all the directors are now really pressing for that. We have used it also for this survey, for the health facility survey, for 1,447, and the results are available on our website. And everyone was happy because everyone from the ministry was available, including yesterday they have also issued instructions to support DHIS2. The achievements that DHIS2 is working, our staff is capacity is built. Everyone now is recognizing DHIS2 as the best way to collect data. We cannot imagine ourselves without DHIS2. I have to go quickly because I am witnessing the time. Challenges: fragmentation of health information system. Yes, because civil registry has its own system. National Center for Disease Control, they have their own, and that's another matter. So still we need time to unify it. Low level of data use, of course, like this complaint of any country, health information staff are not motivated. This is, I mean, the facility at the facility level. My recommendations are we need to add the cause of death especially ICD 11 to the system, design training package for the information users, motivate data entry personnels, and then we need also to have a health record for all citizens, also to capture their data from the health facilities. HISP Libya is in the way because we have already registered this in Libya and will be, inshallah, internationally available. Thank you very much. Very sorry, I have to cut some things because I am actually, this is against the agreement. The agreement is 15 minutes. And then you stay outside for a long time, and then you say, no, please make your presentation short. Thank you very much for giving this opportunity. And thank you. I would like also to thank Dr. Bamud, who was the first person visited and presented DHIS2 in Libya in that situation. It deserves really this. And also really Surab, when he came there, even the security situation was really very difficult, but he managed to do it, he and his colleagues. Thank you very much, and I hope there will be no questions.
So we have one question from Indonesia.
No time for.
So we can take one question.
There's easy questions. How your strategy to motivate your personal data? Strategy to motivate, like you said in your last slide, you say the motivate or make a motivations, give the motivation to your personal data to enter the data to the system. How strategy?
So the question is what strategies you want to put up for motivating.
This matter is actually, it's for all of us, because if we are not motivating the person who's entering the data, they'll feel that they are doing very boring job. And this is number one. Number two, to motivate this person, to give him incentive, at least to use this data. If you use the data, he will be incentivized, will be motivated. But if you are not using even the data, and he doesn't see that this data he is collecting is good for the at least for the country, if not for the country, for the municipality, for the facility. This is the problem. So all of them, they are saying we are just filling forms. What is the result? So we need to give them some motivation, maybe some personal motivation. We know that even training is motivation. Sometimes we give them training. We try to classify facilities, tell them that you are the first one, the second one. We are to celebrate their success. And also, really, the best motivation is to use the data, at least when they see this data is affecting even the medical supply, affecting anything, they will be incentivized to fill in the data in time.
Thank you, sir.
That's all.
Okay, so I think one of the best examples which Libya has said that we started with a team who was very motivated to implement DHIS2 in country. And they had, since initiation, they had a small technical working group who was trained on DHIS2 activities, and the Ministry of Health has kind of emphasized the use of DHIS2 capacity building programs. So because of security reasons, we were only able to visit once and do trainings in country. But then two of the focal points of the country have been very instrumental in attending the academies in the African region. They have attended 3 on-site academies, 2 digital academies to keep building their skills on DHIS2. And as a result, we saw that a small team of 3 people has done 110 workshops in the entire country. So that's why we emphasize on the use of capacity building program within DHIS2 to keep continuous capacity building of your resources. So thank you so much, sir, for your insightful presentation. Next, we move on to the team from Bangladesh. It's an interesting story. The last 10 years of DHIS to use, challenges with scale, challenges of implementation. So we have the team from Bangladesh presenting their implementation story.
Good morning. Assalamu alaikum. So I am Mohammad Abdul Hanan Khan from Bangladesh. I'm the CEO of HISP Bangladesh Foundation. Unfortunately, our MIS colleague is still not arrived. So I have to present on behalf of them. Also, we have with us Dr. Mushfiq Rahman from National Malaria Program. I request him to come here. Also, Mr. Alauddin Chaudhary for National STD and ACE Program. So, you know, the Bangladesh is a very small country. Only 148 and 460,000 square kilometer. According comparison to Libya is very, very small. But population is 169.28 million, which is the extremely dense country in the world. So first we start with the Minister of Health and ask Mr. Mushfiq, Dr. Mushfiq to present.
Thank you very much, Hanan Bhai. For malaria, I'd like to present what we are doing for malaria related to DHIS2. I have only 2 slides, and then it will be followed by HIV. We are really beginner for DHIS2 for malaria. We have started only this year in 2023, and we have conducted the training of trainers in 5 batches in September to October 2023. And we have covered 120 field staff out of 85 health facilities. And this is targeted for the malaria elimination areas, malaria endemic areas. We have total 64 districts and 13 districts are malaria endemic. And we have trained the staff responsible for the data entry at the sub-district level. So covering 72 sub-districts and 10 district hospitals and medical colleges, 3 medical colleges located in the malaria endemic areas. And the DHIS2 rollout started only this month, November 2023, parallelly with the existing dedicated malaria information system, that is a cloud-based system. And we are running this system for a long time. So we decided that the DHIS2 system will be piloted for these 2 months, November and December. And from January 2024, there will be a reporting system. The DHIS2 will be alone, and the staffs that are trained will be reporting through this DHIS2 system. And for this to happen, we got the support from HISP India initially, starting from 2020, and then it has been the responsibility has been transferred to HISP Bangladesh. And Hanan Bhai is here. And they are really supporting us to start this DHIS2 information system. And the future plan is like that from 2024 onwards, we'll start the case-based surveillance, focus investigation and response. This is a part of the malaria elimination. And as the target is coming very, very quickly, we have the target to have the malaria elimination throughout the country by 2030. So we are planning to include this 137 strategy. That is the case investigation followed by focus investigation and response to be included in DHIS2. And we have planned also to include these LMS that we learned in this morning to be included in DHIS2. At the same time, we also encountered some challenges. The challenges, there are some generic challenges. First one is the HR issue, the trained HR that we have already trained. There are frequent transfer from one place to another place. So as the target areas is limited to 13 districts, so they might be transferred from that area to other areas. So that is one issue. And also we are getting support from the Global Fund for the implementation of different activities that also includes this DHIS2 and from the Global Fund, but there is a decision that the support will be transitioned from the donor support to the domestic support. This will be another challenges. And to get the real-time reporting is also an important issue because some of the health facilities and also the community located in very hard-to-reach areas, and getting the real-time reporting is really a challenge. At present, we are expecting to get the report only at the sub-district level. So this is also a challenge to get the report from the community level. And I think Hanan Bhai will also show the other instances. So integration with malaria with the other instances is also a challenge. And to get the certification for malaria elimination, we need to prove that there is no indigenous transmissions of malaria throughout the country. So we need to expand this DHIS2 system specifically related to malaria throughout the country, meaning that covering 64 districts. So these are the challenges that we are expecting to have during the implementation of DHIS2. Thank you, and maybe Mr. Alauddin, you can continue. Thank you very much.
Thank you, sir. Good morning, ladies and gentlemen. I am Alauddin Chowdhury, and I am representing the HIV/AIDS status in Bangladesh very shortly. And my presentation have 2 slides. And first slide just some information, and second one is this information, especially HIV information, how to integrate the DHIS2. And first of all, this slide, you see the first diagram. 2022, the first huge case, especially 947 HIV case identified in this year. And another slide is estimated HIV in 14,000, and compared to 14,000, 9,700 is the diagnosis, and 6,075 is the enrollment and treatment, and another is viral load people. And you know, HIV have 3 global indicators: first 95, second 95, and third 95. And this is the compared to 3 years, 2022, 21, 22. And Bangladesh have first 95 in standing 67%, second 95 is 77%, and third 95 is 90%. And all kinds of information go to the DHIS2. DHIS2 in the HIV program have 2 databases, and one is KP information, and locally is called the KP database, and another one is PLHIV tracker. This is a start from 2013. So 2 setup. We use the HIV program in 2 setup, and all information go to the DHIS2 and as a regular basis. Especially KP information is going to DHIS2 in quarterly basis, and tracker is the instant information. When any HIV positive case in any places, anywhere in the country, instantly enter in the PLHIV database, and central level, this data is getting instantly. So this is the information about HIV program, and I hand over to Mike Hanan Bhai. Following slides. Thank you.
Thank you. Thank you, Dr. Mushfiq and Dr. Mr. Alauddin. So we actually need more than 15 minutes. So I tried to be short. For Bangladesh achievement, if I want to describe on behalf of MOH, then it will take maybe 1.5 days at least. So I try to be within 4 minutes, maybe only the highlights. So first thing is I want to show you the data use, because data use is a huge topic here. So data use, we can at least explain all use, take at least 4 hours. So I will try to be measure 3 use. One is the decision making. So we have a disbursement linked indicator, means the fund will be released if they can achieve certain indicators. So this is the DLI. So this part is the DLI public dashboard. So the managers and everyone can follow that. And according to that, every year they claim the additional money. So this year, 400 million will be released based on that. So data, there's the incentive, so that if they cannot achieve this indicator, they'll not get the additional funding. So that's how the program is motivated to do this. The second motivation was the HSS. health system strengthening. This actually scoring method. So if they enter reporting on time, achieve certain target, then we'll get the scoring, each facility, and each facility got the scoring by type. So they got awarded at the end of year as a best facility award, also as a worst facility. So this grading actually is the motivation for the facility to enter data on time properly. Also the data quality, that's also be one of the marking part. So this is one example how we can use the data, used in many cases. And monthly decision making, we have the regular monthly meeting where the evaluation is done on 15th, 20th, and 22nd date of each month. So that's how they can rectify and correct the use. Another major use which we don't present here is a local health bulletin. There's one automatic PDF version of the health bulletin published from the routine data on the regular basis each month. So each facility has their own PDF-based health bulletin, which they can publish. Another or the largest central server, which we have the new additions. So I am not putting all this. So only the new addition, we have the hospital morbidity, which is the event capture, where we added new thing is modified is the SCANU. So SCANU is a tracker where we can have the advanced level in a special newborn care unit. We added dengue surveillance last year, which is the case-based also surveillance. So each will track the general inpatient, the EMLC, and also the birth notification to the CRVS. We also have WHO causes of death, and where all hospital and private hospitals also included. So these both cases, private is also have to be reported in the DHIS2. But these cases, they have to only reported in the DHIS2 modules only. So the vaccination also as a major part where we have the vaccination utilization data. Also, we have vaccine logistics. That's include indenting supply and stock status and wastage. We also have IMCI. We also have NSU in the same program, same instance. We have hospital statistics, kangaroo mother care, leprosy, ELMIS, which has the essential MNCH medicines, TB aggregate data. So TB 10, 11, 12, WHO reporting format. And also we have VPD and AFI surveillance on that specific instance. So this is one of the largest instance we have. We also has the community HIS, which is actually reported from the 14,146 facilities from the community. So this is the serving as a MNCH to the mother at the community. Also that has child tracker, which actually the basically combination of IMCI and nutrition services for the child. So this too is a case base, and we have the significant amount of data in this instance. Also, we have maternal and perinatal death surveillance in that specific community-based server. COVID-19 surveillance is another example where we learned a lot, and we use the COVID-19 package, and we customize for our country need. But COVID-19 systems is a combination of not only the DHIS2, but it has other components. So that is one example where we also use the private facilities, and private facility we're not only using directly DHIS2 through the API. So we make a common gateway where from their own system, we can import data, even the open MRS-based systems. So that's also one example where we have to make the private facilities have to report in the DHIS2, even from their own systems. Very quick. So NCD is another part where we have the cervical and breast cancer. So where actually the community registration, this actually multi-layer. So at the community, the ladies are registered for the cervical and breast cancer at the community level, where the age between 30 and 60, then they come to the upper, because community doesn't have any facility for cervical cancer screening. So we have the cervical cancer unit at the sub-district level, and where we can use the via method, but any one other method like HPV DNA, pap smear, and others also can be done. If they have scanning report, they can come to the facility and register for the next level enrollment. Those treatments are free up to the cancer treatment level. Cancer treatment also partially free, made by the government, specifically for cervical cancer and the breast cancer. So biopsy and diagnosis management, that's also done by the government hospital and private hospital. All those facilities, not only government, this is also private. For example, there is several NGOs are entering and registering persons. And cancer treatment, we have 3 public large hospitals, the Cancer Institute, BSMU, and another one. And also we have one private hospital, cancer hospital, which is also serving under this same umbrella. So this is one example of NCD surveillance. This is a public dashboard on the right. And so where they can see what's happening and how much is. So if we compare the data from the 2020 and 22, we had a good progress, at least cancer detection. And this is only detection and treatment. This also has a BCC, behavior change communication, so that we can reduce and prevent the breast and cervical cancer. So this is another hypertension dashboard where we have the hypertension control parameters and missed visit control and other indicators we are monitoring in the public dashboard. So another part is the Ministry of Local Government. You know, the Bangladesh, the health is divided in 2 parts, Ministry of Local Government and Ministry of Health. So Ministry of Local Government, we recently implemented the urban HMIs, where we have actually 11 city corporation, 18 municipalities, and 45 project areas. So this is the area we have where this tracker, this is a tracker, and this is a very challenging tracker. Because of the satellite clinics, we have to offline entry. So this also feed to a public dashboard for the urban. So this also, so that the decision maker, the ministry people can see the data without logging in and have the monitor how the service is going on. So this is one example of the DHIS2 dashboards. And this is the implementation level where they're using the tab and the web interfaces, they're entering the data. So this is the overall status of the country implementation. So green are all DHIS2 implemented. So on the right-hand side is the Ministry of Health part. So almost all is done. So we have the IDCR part is not yet properly done. So now we are following up the IDCR on the right-hand side, left-hand side, there is a urban primary healthcare and other Ministry of Local Government. So that's we are gradually now catching up. So thank you, everyone. Thank you, Saurabh.
Thank you, Hanan. So quite a lot of interesting work going on in Bangladesh. The Hanan and his Bangladesh team would be here. If you have any questions, please feel free to reach out to them. So we can just take one question before the Uzbekistan team sets up their logistics for the presentation. So one question, please. Yeah.
Thank you, Bangladesh. That's a interesting presentation that you have present. I'm Rebecca from Solomon Island. I have 2 questions. I just want to know what award do you give to the health facilities that report that do their on-time reporting, that has highest reporting rate? And the second question is, what do you do to the health facility that has the highest delay of reporting their data? Thank you.
You want to know the highest reporting rate?
Yeah. What award do you give to the health facility?
Okay. The main incentive is we have the Health Minister Award. So depends on the reporting on time has a point, and also the several data sets, the targeted data set has a point, so that they have to enter data in time. If they enter, they got certain point. If they late, they will let's cut the point, and this way. So they have a scoring. Each month they can follow up on their scoring, where the position. If they are, say, out of 400, there is a 400, then they are sure that they will be not getting the prize. So there is a competition. So we should make their managers also up to them. Why you are not entering on time? Why the data quality is the problem? So those kind of things. So this is not only the DHIS2, also the on-site visit, the data audit. This also has a marking. So there's also the part of health system strengthening, which is we are doing in the DHIS2. Even the scoring part is in DHIS. So if you want to learn more, we are here all week, next few days. So we'll be supporting.
Thank you.
Okay, so we're still figuring out the presentations. There's one question. I saw a hand here. Yeah.
Hi, everyone. I just saw e-limbs in your presentation. I just wanted to know which e-limbs you're using in your country and whether it is integrated with DHIS2 or you have created some toolkit within the DHIS2.
Okay.
Yep.
ELMS, what we are using is the DHIS2 as a ELMS. So we actually started, I think it's 5 years back. So is that 2018 we started the LMS. The urgency was that we have to track the essential MNCH medicine. So we have distributed medicine to maternal and child, which is the essential med, which is 34 drug. So that was the target for the government to follow. So that's we build inside the DHIS2, not in a separate model we do. So that's we try to address those immediate need, but still we are using that. But in future, maybe we are switching to the new LMS module because there is a more need of the vaccine logistics is more detailed, which we are doing up to certain levels fine.
Thank you, Hanan and the Bangladesh team for the insightful presentation. So next two presentations are from a new DHIS2 region, the Central Asian region. So Uzbekistan journey started recently in 2019. So we have Yuri from Team UIO, who has been closely working with the Uzbekistan team and quickly take you through the updates and what has been the main challenges in implementing DHIS2 in a new region. So Yuri, over to you.
Hello, everyone, and I'm very excited. We're, as Saurabh said, one of the youngest regions, and I think Uzbekistan is the maybe youngest in the implementation, and we're about to start. My presentations will be very short, and I hope I'll give you a quick overview of what is happening. So, Uzbekistan, I'll give you some key data about the country. So with a population of 35.6 million, it's one of the largest countries in the Central Asian region, with the capital city of Tashkent, almost 3 million inhabitants, one capital, 12 regions, and one autonomous republic. And it's a country double locked from the sea, bordering Kazakhstan, Kyrgyzstan, Tajikistan, Afghanistan, and Turkmenistan. To the DHIS2 activities. In 2019, in the collaboration between WHO, Euro, and the country office in Uzbekistan, the NTP, the National TB Program, and the UIO, we have started on planning DHIS2 activities in the country. And the reason for that, the fact that Uzbekistan is one of the high TB burden countries, and the focus during those activities was on TB. And we started with a very ambitious plan to introduce DHIS2 by using tracker without any further prior work on the aggregate or on the HMIS forms. So we were unfortunately interrupted by the COVID pandemic, and the work was difficult during that time. And then we resumed in 2021 with the preparatory work. We started on the adaptation of the TB tracker, and it came in handy that I was working with the country and at the same time working with WHO on developing the TB toolkits. We've translated the DHIS2 platform into the Uzbek language and the two variants of that with Cyrillic and the Latin scripts, which is not easy to implement, but we're working on it. Also improving the Russian translation of the total DHIS2 platform, because the Russian language is a binding language in the region as well, and is very helpful to use it for communication. So at the same time, we worked on the documentation and metadata. We went through the certification and accreditations procedures within the country with security clearance and various applications to the Ministry of Health for certifications, and we are lucky to have got it. Parallel activities in the country, also supported by UIO, as there currently is no HISP in the region yet. So WHO, in collaboration with NTP Uzbekistan, have launched the implementation of the anti-tuberculosis drug resistance survey in the country, making it the first nationwide implementation of DHIS2 on the regional level. And in December 2022, we got some great news as the presidential decree included DHIS2 as a platform to be used for digitalizing TB registers in the country and reporting and planning. So supported by Global Fund, the implementation plan for TB case surveillance was created and approved, and the key parties were identified as the national TB program of the country to be the implementer, IT Med, the colleagues present here, as part of Ministry of Health Ministry to be hosting and building capacity within the ministry for DHIS2 implementations, the UIO as supporting organization, and then WHO and Global Fund. In addition, we have included in our communications and collaboration the EPT associates that have launched a large-scale TB-free Uzbekistan program in September 2023 in the country. And this is what is going, this is what is happening now and what will be going on in Uzbekistan in the upcoming years. So we're starting with the pilot in the two regions, so the Tashkent city and the Fergana region, at a district level. So we have the 29 districts going down to the facilities and labs for the tracker. We're going to be aiming at scaling up to the nationwide implementation in the course of 2024. We will begin with the support of the MOH reporting to remove the burden of work from the statistical departments so that they can start looking at the WHO dashboards and more, moving to the more advanced analytical activities. We will include have included the laboratory structure in DHIS2 and providing the data entry at the laboratory level. We'll be working on the laboratory dashboards and the integration with the laboratory management systems that are also in the planning and in the making. We're integrating the DHIS2 with the National Medical Information System, MIS. So on the user level, with the single sign-on, we're integrating DHIS2 with the civil registry to make it easier for the data entry people to work with the system. We'll be introducing the household contact tracing models and TB screening. Basic stock management will include the standard WHO dashboards and the DRS, the drug resistant dashboards in the routine TB tracker. And of course, the main purpose will be working on the capacity building within MOH, the NTP, which will also include the training of trainers. That's short and sweet. Thank you.
Thank you, Yuri. So any questions for the Uzbekistan team? Okay. So Yuri will be here for the remaining of the conference. So please, if you have any questions on the Uzbekistan implementation, please feel free to contact him. And we have representative from the Ministry of Health Uzbekistan as well. So next we have the final presentation for this session from the team from Kyrgyzstan. There's a little logistical information. The team would be giving the presentation in Russian, and we have Nurgul with us, who's the interpreter. So she'll be translating the content in English for all the audiences. So
Добрый день, уважаемые участники. Хотим приветствовать вас от лица Министерства здравоохранения Кыргызской Республики. Мы представители Республиканского центра иммунопрофилактики, это программа иммунизации. И хочется выразить огромную благодарность организаторам сегодняшнего совещания за приглашение принять участие. И для нас большая честь участвовать здесь, на этом совещании, и быть вместе с единомышленниками при внедрении DHIS2.
Good afternoon, dear participants of this event, of the conference. It's a great honor for us to make the presentation and to welcome you all on behalf of the Ministry of Health of the Kyrgyz Republic. We are representing the Republican Center for Immunoprophylaxis or Immunization, which is the authorized body responsible for all the vaccine-associated issues. And I would like to say that it's a big honor for us to be here with alliances to discuss all the issues related to the DHIS implementation.
Сочли правильным тоже поделиться опытом Кыргызстана по внедрению DHIS2, поскольку вчера и сегодня мы видим успешный опыт внедрения в странах, и поэтому хотелось бы поделиться с вами тоже опытом.
So thank you so much for updating us about the progress of DHIS2 implementation in your countries. And we thought it would be a good idea to share our experience of DHIS2 implementation in our country.
Для информации, Кыргызстан, может быть, некоторые наши участники не знают о нашей стране. Хотелось бы сказать, что Кыргызстан очень красивая, горная страна. И если говорить о Кыргызстане, то общее население почти 7 миллионов человек. Столица Бишкек, и мы граничим по территории, это с Казахстан, Узбекистан, Таджикистан и Китай.
So for those who do not know much about Kyrgyzstan, we would like to say that it's a very beautiful mountainous country, which is located in the Central Asian region, with a size of the population of almost 7 million people, bordering on the countries like Kazakhstan, Uzbekistan, Tajikistan, and Kazakhstan, with the capital of Bishkek.
Это краткое видео о нашей стране.
It's a very short video about our country.
Добро пожаловать в Кыргызстан.
Welcome to Kyrgyzstan.
Если говорить о внедрении DHIS2,
Now moving to the topic of the presentation or DHIS2 implementation.
буду краткой, потому что в 12 минут уложиться очень
I'll try to be very brief because
но
it's
буду
very
стараться.
difficult to fit into 12 minutes, but I'll do my best.
После проведенных нескольких оценок миссии в стране благодаря поддержке Всемирной организации здравоохранения ЮНИСЕФ было принято решение внедрения DHIS2 как реальный инструмент. Вчера об этом мы говорили не только для лиц, принимающих политические решения, но непосредственно, кто работает в программе, специалисты в программе.
Actually, the decision to implement DHIS2 in the country was based on the several situation analyses which were conducted in the country with the support of WHO and UNICEF as the necessity to introduce a real tool of information system for vaccination immunization, not only for the decision makers, but for all the people working in the immunization program.
Хочу отметить, что Кыргызстан является страной, которая получает донорскую поддержку от Глобального альянса по вакцинам и иммунизации, и поддержка именно с этого фонда была при реализации и внедрении DHIS2.
I would like to inform you that the Kyrgyz Republic is supported by Gavi as a donor, and Gavi was the donor who is supporting the implementation of DHIS2 in our country.
Программа, как и любая программа иммунизации, желает иметь в идеале комплексную программу, комплексную систему, которая бы включала все элементы программы, в том числе и планирование, и холодовую цепь, и надзор за побочными проявлениями, эпиднадзор. Но, учитывая возможности страны, мы начали с этого момента.
Ideally, we would love to implement all the functionality of the DHIS2, including the planning, forecasting, management of AFIs and reporting, epidemiological surveillance, etc. But taking into account the context of the country, we were focusing on several elements.
В 2020 году было принято политическое решение Министерством здравоохранения принять DHIS2 в программе иммунизации.
So back in 2020, the Minister of Health has made the policy decision to introduce or to implement DHIS2 as a tool for vaccination.
В краткосрочной перспективе это внедрение DHIS2 как онлайн-система отчетности данных и визуализация данных.
So we have a short-term and long-term perspectives for DHIS2 implementation in our country. From the short-term perspective, we have to implement DHIS2 as a tool for vaccination reporting system with visualization.
Я думаю, что, как и в многих странах, есть проблема кадрового дефицита и проблема времени для них, поэтому система, которая бы DHIS дала онлайн-систему отчетности, дала бы сокращение времени и возможность для проведения хороших анализов, получения дэшбордов.
Similarly to other countries, the Kyrgyz Republic is facing the biggest challenge of deficiency of human resources, and that's why, in order to save time, energy, DHIS2 online reporting system facilitates the health workers to be more focused on analytical part of the work.
В долгосрочной перспективе, конечно же, была цель, идеальная цель получить персонифицированный учет иммунизационных услуг, логистика вакцин, расходных материалов и инвентаризация оборудования холодовой цепи и средств транспортировки.
From the long-term perspective, DHIS2 should help to implement the personalized or individualized accounting of immunization services, logistics of vaccine commodities, and inventory of cold chain equipment and transportation means.
В краткосрочной перспективе мы эту реализацию уже сделали. На сегодняшний день DHIS получила реализацию на уровне центрального, областного и до районного уровня. Мы внедрили DHIS2.
And currently we have managed to implement DHIS2 at 3 levels, at the national, regional and district levels so far.
И здесь хочется сказать спасибо огромное. Это сотрудничество HISP India, поскольку благодаря поддержке Глобального альянса по вакцинам и иммунизации DHIS2 был адаптирован под нормативно-правовые документы Кыргызстана, и на сегодняшний день мы работаем с DHIS2 именно до районного уровня.
And taking this opportunity, I would like to express deepest gratitude to the HISP India and the Gavi for the support, for the continued support provided, and for adapting the DHIS2 for the context of the Kyrgyz Republic. And currently we're working and we have implemented DHIS up all the way to the district level.
Но я говорила, что идеальной целью для программы иммунизации является персонифицированный учет, поэтому мы стали двигаться дальше, потому что на тот момент, когда мы принимали DHIS2, персонифицированного учета не было в DHIS2, а нам нужно было двигаться дальше, и для этого принято решение в период пандемии COVID-19 персонифицированный учет и реестр вакцинированных COVID-19 явился удачным вариантом для того, чтобы его адаптировать для, скажем так, расширенной программы иммунизации, плановой иммунизации. И мы это сделали. На сегодняшний день есть уже система, работает информационная система IM2, и где есть персонифицированный учет не только COVID-19, но и для плановой иммунизации.
And actually, we don't want to limit ourselves just to implementation of DHIS2 all the way to the district level. And as I have already said, from the long-term perspective, we wanted to implement or to ensure the personalized or individualized or individual counting of all the immunization services provided in the country. And that's why during the COVID-19 pandemic, without waiting for this individual counting, which was not available at the time under DHIS2, the Kyrgyz Republic has developed its own COVID-19 registry. And actually we have managed to integrate it not only for the pandemic, for the COVID-19 vaccinations, but also to the routine immunizations in the country.
Когда я утром комментировала по логистике ЛМС, я говорила, что система IM2, информационная система, за неимением этой функционала в DHIS2 Мы в информационной системе АМД сделали модули по складскому учету и по холодовой цепи.
Today in the morning, I has already mentioned that we have been there. So we were in a rush, and that's why we have developed our own modules under the overall streamlined immunization information system, which is called IMD, and we have developed the separate modules for inventory and for the cold chain equipment management.
Я сегодня говорила в начале своей презентации, что DHIS2 в программе иммунизация, но в стране используется DHIS2, это в регистре, канцер-регистре, также используется ВИЧ-СПИД и используется по туберкулезу.
Actually, DHIS2 platform has been rolled out to expand it to the vertical programs of tuberculosis, cancer register, and HIV/AIDS.
Да, и эти проблемы, нужно сказать, что вызовы, наверное, из-за того, что нет такой политической заинтересованности была на тот момент для того, чтобы иметь DHIS2 как платформа для системы здравоохранения. Поэтому были в разрозненных проектах DHIS2.
So now moving to the challenges. At that time, there was the lack of political will or commitment, and that's why at that time DHIS2 was not applied as the unified platform for all the vertical programs.
Сегодня Министерство здравоохранения уже приняло политическое решение и уже оцифровано 33 отчетные формы на платформе DHIS2.
But currently the Ministry of Health has made the policy decision, and as of today, 33 reporting forms have been digitalized through the DHIS2.
Которая будет интегрирована с различными базами данных системы здравоохранения.
Which will be integrated with all the information system and databases in health sector.
В том числе и программа иммунизации.
Including immunization program information
И
system.
самым главным, наверное, вызовом это то, что отсутствие, скажем так, сильного потенциала, национального потенциала, который бы работал с DHIS2.
And the biggest challenge is the deficiency or the limited capacity at the national level as far as the IT is concerned.
Чтобы знал весь функционал DHIS2.
To know the entire, the full functionality of DHIS2.
Есть вызов также по компьютерной грамотности медработников, которые работают на уровне оказания услуг, но мы над этим работаем.
Computer literacy is another challenge. For the health workers in the fields or in the sites, but this is the area that is being attended now.
И сегодня также информировали, что в отдельных странах есть проблема, скажем, интернет-соединением, да, я говорила, что Кыргызстан это горная страна, поэтому есть немного в некоторых отдаленных районах проблемы с интернет-покрытостью.
Some of the country has already mentioned it as a challenge that the internet coverage is not the best one, and since Kyrgyzstan is a mountainous country, it is also a challenge for our country.
Проблемы при внедрении DHIS. Прежде всего, хотелось бы иметь сотрудничество HISP Индия – это уникальная, хорошая возможность. Но право редактирования страна должна получать в полной мере, чтобы быстрее реализовывать, скажем, весь потенциал, который имеет DHIS2.
Moving to the DHIS2 implementation, specific challenges. This is the unique opportunity to collaborate with HISP India, but each country should be authorized to or should have access to the full functionality and editing.
И, конечно, были небольшие проблемы в плане обучения медработников, потому что это делали, скажем так, видеообучение, онлайн-обучение, но мы видим, что в плане вот таких вот обучения, онлайн-обучение не оказывает своего влияния.
So the challenge is the training or the level of knowledge of the health workers. Definitely the Kyrgyz Republic went forth producing some tutorials, videos for the health workers training purposes, but we have understood that online trainings are not that efficient.
Какие же наши дальнейшие, скажем, планы в продвижении DHIS2?
And way forward for DHIS2 implementation in Kyrgyzstan.
Есть дорожная карта по цифровизации в программе иммунизации, и одним из ключевых моментов стоит это, скажем так, реализацию функционирования, интегрирования АМД с DHIS2.
So the immunization program information system has developed a roadmap for its development, and one of the objectives is to integrate the IMD immunization information system with the DHIS2.
Сегодня с Министерством здравоохранения, с Центром электронного здравоохранения делаются настройки для того, чтобы передача данных из АМД информационной системы была в платформу DHIS2.
The e-center under the Ministry of Health is investing efforts into functionality of the transfer of data from IMD immunization information system to DHIS2.
Далее модуль передачи статистических данных из АМД в платформу DHIS2 посредством шлюза.
And it's being developing the module for transfer of the statistical data from IMD information system into the DHIS2.
И сегодняшнее совещание для нас является уникальной возможностью увидеть полный или обновленный функционал именно в DHIS2, какие новшества планируется сделать. И это было очень замечательно. Я предоставлю слово моему коллеге.
And it's this conference, so this is a unique opportunity for us to be exposed to the updates and the innovations in the DHIS2 and the future implementation in the Kyrgyz Republic. I'd like to give the floor to my colleague.
Да, спасибо вам большое. Как уже мы ответили, что DHIS, он идем в национальный уровень, в областной уровень и на районный уровень.
This is just the information flow all the way from the national, regional to the district level.
И так как госполитика выбрала АМД, и этот АМД, он будет уже функционировать с первички и будет связан с DHIS как единая система.
So through the integration of the IMD immunization information system with DHS, we'll be able to cover even the level of the PHC, primary healthcare.
Как видите, это поток информации при получении данных. И до DHS эта вся схема, она была на бумажных носителях.
So actually, in the past, before implementation or introduction of the DHIS2, the entire information flow was paper-based.
Я хочу отметить о том, что к руководителям DHIS2, что у Центральной Азии есть огромный потенциал по продвижению в кулуарах нашей страны. Ведутся разговоры о использовании DHIS2 на Статкоме.
And actually, we're not only for the technical support, but we would like to boast a little bit, saying that there are some negotiations or there are already conversations about implementing or integrating DHIS2 into National Statistics Committee.
Спасибо огромное
Thank you so
всем.
much.
Мы рады сотрудничеству. Открыто, Кыргызстан открыт. Добро пожаловать к нам.
Looking forward to the future cooperation. Kyrgyzstan is an open country. More than welcome. Thank you.
Спасибо.
Thank you, Team Kyrgyzstan, and thank you, Nurgul, for the excellent facilitation. So are there any specific questions from the Kyrgyzstan team? So just wanted to share some update with the Kyrgyz team that we are actively working on finding regional experts on DHIS2 who are proficient in Russian language so that we can have more local support. And moving forward, we're also planning in-country academy using the Russian experts that we have at UIO to be there and train the core team again on the DHIS2 concepts. So we're working towards how we can strengthen the capacity of the core team in Kyrgyzstan. So thank you. All right, so we are right on time. So thank you everyone for keeping your presentations concise, and I hope the updates were insightful from the set of countries we had today. So before we go for lunch, some logistics information. So all the sessions post-lunch are parallel sessions. So you, based on your choice, you will need to segregate yourselves into the two venues that we have. So post-lunch, we have two parallel sessions, one on LMIS that will be taking place in this room. And the second one is on security that would be downstairs in the Gregory Hall. Then that would be proceeded by the tea break. So tea will be served here. And then after tea break, we have two parallel sessions again. We have a session on data quality that will happen in this room. And then we have a session on they can help with in last session. Climate and health, sorry. Climate and health, that session will happen down in the Gregory Hall, sorry. So we can proceed for lunch, and based on your choices, please feel free to join the sessions accordingly. Yeah. Thank you, everyone.